Hello, everyone. It's Monday, June the 13th. We've now crossed 7,000 deaths in West Virginia. It's a milestone that none of us want to celebrate in any way. We only have 4 additional deaths since my last briefing, but you know, like all Mondays are, we just maybe don't have all the stuff into the system from over the weekend. But I ask for your prayers in many, many ways. The 6,998th death is a 96-year-old male from Cabell County. The 6,999th death is a 67-year-old female from McDowell County. The 7,000th death in West Virginia is a 75-year-old male from Cabell County. And the 7,001st death is a 53-year-old male from Cabell County. It's unbelievable, you know, and we've all lived it, and it's just hard to fathom. I mean, you know, if you think of all the tough things that we see on the news from time to time over the years, the mine disasters or a plane crash or whatever it may be, it's a drop in the bucket compared to this. 7,000 great West Virginians, in fact, 7,001 great West Virginians we've lost. Our active numbers are 1,989 that are active cases in West Virginia, 1,306 new positive cases in the last 24 hours, daily positivity rate at 9.47, cumulative rate at 8.14. We have recovered cases right at 515,000 in the state. We've crossed 200 that are hospitalized. We have 208 people hospitalized now in West Virginia, 35 in the ICU units and 7 on ventilators. Our map continues to remain green and yellow, and we'd like it to be all green, but it's not maybe all that bad. I remind everybody over and over, as I've done 1,000 times, get your booster shots. Please get your booster shots, especially those 50 and older. If you're out 4 months or whatever the time period may be, your immunity is almost zero. So just remember that. If you have absolutely gone to the trouble of being vaccinated, don't sit on the sideline. Please don't sit on the sideline and let this stuff whip around and get you, you know, so please get your booster shots. Here's some numbers that I don't get every day, but I'd like to share just a little bit of this with you. In the state of West Virginia, we have people that have taken at least the first dose. A population of 1,792,000. We've had 1,133,000 of those people, really 1,134,000 of those people that have gotten at least one shot. You know, our booster shots, you know, and that equates to 63.3% of the total population with at least one shot. Our booster shots still lag behind. We have gotten, for eligible folks in West Virginia, we are at 52% that have got their booster doses. Here's another thing that is, you know, I'm not going to go through every last one, but from the standpoint of the total doses that have been administered in the state of West Virginia to West Virginia residents, the number of shots that we've given, it's amazing. It's 2,623,985 shots in arms. Now that includes first vaccine, second vaccine, first booster, second booster. It includes everything. But the great people in all the health communities, whether it be the pharmacies or the local health clinics or on and on and on, National Guard, over and over and over, all the great people, 2,623,985 shots they put in West Virginians' arms. Been a lot of good work by a lot of great people. The vaccine calculator is up. You know, it will tell you when you need to get your vaccine. I really highly advise you to take advantage of this and get registered into this. All the other stuff as far as free testing and All the information about the COVID-19 vaccine info line is up on our website. We have 78 outbreaks in our long-term care facilities. That's up. None in the church communities. That's good. We have 202 inmate cases and 33 staff cases. That's up a little bit too. From the rental assistance program and the homeowner assistance program, take advantage. Please just call us. If you're a renter, if you're a landlord, if you own a home, call us and everything, and we'll see if we can get you qualified to get some dollars in your pocket. If you're hurting and you're behind on something and everything, just call us. Just call us and we'll see if we can help. I remind you about giving blood. Over and over I've said just that and everything, that especially if you have survived this terrible, dreaded pandemic, please at least check with your physician and see if it would be okay for you to consider giving blood. Now, I got a couple of things here I want to talk to you about, but these are water development grants, and we just awarded $12.8 million for 3 major water sewage improvement projects across the state. Now, not long ago, I asked the legislature, and I called a special session asking the legislatures to put $250 million aside in this program. $250 million that we absolutely could use as far as leveraging dollars on the local level with federal dollars or whatever it may be, when people have exhausted every single possibility of what they could do to get a water project, a sewage project done in their communities. And we know all across this state, we still got a lot of people that need clean water. We've still got all kinds of sewage projects that we need to do across the state. And we need to do them, and we want to do them. And so I commend and I thank the legislature for doing what I sent up in the special session and putting that $250 million aside for us to be able to do these projects. And right here we go. With a project of $3.4 million in the city of Ripley to start construction on a wastewater treatment plant that will serve Ripley and the community of Evans. A $1.8 million grant to the city of Richwood for its Hinkle Mountain Little Laurel Water Extension Project. And $7.5 million to the city of Lewisburg to improve their water system in Lewisburg. Absolutely, I want to thank all the work that's been done in every facet here. But with all of that, if we could just step back and just think about it. An idea, money's available, don't waste, mind to store the right way. We called a special session of the legislature to come back and put $250 million aside. They did so. I thank them for that and everything. But now here we go, doing stuff that is great for the citizens of West Virginia in every way. Projects that needed to be done decades ago, but we're having the opportunity to be able to do them right now. We're going to continue to just keep doing project after project. As we get them in, we'll try to see if there's any funding in any way, and we'll use these dollars to leverage every way from federal dollars to matching dollars to on and on and on. And hopefully this $250 million will turn into a multiple of that, and more of our projects get done. I mean, it's really, really good stuff. Now, from the standpoint of our DEP, they have a brownfield revolving fund now, and today I am announcing that brownfield revolving fund has provided its first low-interest loan to the city of Wheeling. Now, what this is all about is, there's been areas where we've had, whatever it may be, but let's just say from the standpoint of the steel plants that we had around Wheeling at one time or another. And there's probably been a lot of stuff that's gone in the ground there that's probably not very good stuff. And so from the standpoint of what are we going to do? We've got that land's available and everything else, and it's absolutely just laying there doing nothing now. And it's an eyesore on top of that. So the DEP's come up with a way. way and everything that, that banks will maybe look at this on a more friendly basis and be willing to loan dollars, but we have to have participation on our part. So right this second, today I am announcing that the Brownfield Revolving Fund has provided, like I said, its first low-interest loan to the city of Wheeling. The funding will help the city to remediate and redevelop the former Penn Wheeling closure site. It's nothing but good stuff. This absolutely just makes us better in every way, and absolutely I commend the DEP and all the great work they're doing there under Secretary Ward, and great job, Harold. And so it's an exciting announcement today for the city of Wheeling. We want to just keep pouring it on and keep doing more and more great projects like this. So with all that being said, the only other thing that I've got is just this, is our agencies absolutely are trying to scour every possible grant and grab every federal dollar that is available to us and bring them to the goodness of the people of West Virginia. Now, in doing so, and I'll announce more about this in the days to come, from the funding from the governor's office, we're going to hire a person that is going to do nothing in D.C. except scour every possibility that we can possibly have. We're going to have a shared office there, and this person is going to do nothing but look for every possible grant that can come to West Virginia. It should have been done a long time ago. We talked about it a long time ago, but we never did anything about it. There is right now 381 possible grants that West Virginians could tag on to and everything. So we absolutely, we want to assist and help in any way possible and everything. And I told our people, great work by several of the different people here in our office, and they've been to D.C., they've done a lot of work, in interviewing people and everything. They've selected a person, and we'll get on with that later on and everything. But that person should, in multiple ways, pay for their salary and everything. It's just as simple as just this. If you have somebody that's really qualified and they're on point and they're digging all the time, there's so much stuff that's going on here, it's unbelievable, in lots and lots of different directions. And if we hit a little lick at it here and hit a little lick at it there, at the end of the day, we're not going to probably get much done. But if we got somebody that's really dialed in and somebody's working it all the way, all the time and everything, probably absolutely a lot of good successes. Should have been done a long time ago, and just trying to bring more and more good stuff to West Virginia. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And as the governor read the names of the great West Virginians who have died from COVID-19, we have now passed the 7,000 mark, which should give us a moment of pause. And as we know, across the country, we've lost over 1 million Americans with COVID-19. And as we look at COVID today, we see that the most infectious forms of COVID-19 are now present. So we currently are seeing the most recent number of cases go up related to the Omicron BA2 and BA2.12.1 variants. But in the United States, not yet in West Virginia, because we're always a little bit behind others, but in the United States, the BA4 and the BA5 variants are now gaining a lot of traction. And the projection is that these two variants will start to replace the BA2 and the BA2.12.1 variants in the next several weeks in the United States. And the thing that's important about these variants are, starting with the BA2.12.1 variant and the BA4 and 5 variants, the newest variants that are here, the BA2.12.1 variant and the ones that are coming here, they are not only more infectious, but they also replicate better in the lower airways and the lungs. And we are seeing about a 20% increase in hospitalizations around our country. And in West Virginia, we have now, we're approaching 220 people in the hospital, and that is up from a low of about 77 that we saw at the end of April. So this is not said to scare people, because still we are not seeing the kind of hospital numbers that we saw before, but to make people cognizant. And these variants are so infectious that, as we've seen, they're breaking through some people that have had vaccinations a while back. And that's the reason why the governor is being so persistent, and we all are, about trying to help people see that staying up to date with the vaccines is absolutely the best protection that you can have against these variants. And we know that although the variants can break through sometimes people that have had previous infection and immunity from that, or who have been vaccinated 4 months ago or longer. So that's the reason why staying up to date with vaccines is so very important. It's also been reported that with these new Omicron variants, that some of the rapid testing may not register positive as quickly as we had seen before. And so if you do develop symptoms of COVID-like disease, and the symptoms continue to progress, even though you would test negative with, say, a home test, it's probably a good idea to continue to test yourself, not only so that you make sure that you aren't infectious to spread it to others, but also if you're in that vulnerable age category, 50 and older, then we can also try to help get you the appropriate treatment you need, whether that's Paxlovid or whether monoclonal antibodies or others that might be life-saving for people that are in really high risk categories. And remember, we are seeing with these variants, particularly these newer Omicron variants, that these are really affecting older people more and more. And even older people that have gotten 2 vaccines, say in the past, or maybe even had a 3rd vaccine, but that 3rd vaccine's been a long time ago. Michael Osterholm, who's really very smart about this pandemic and is a national CNN correspondent and has been involved in this whole pandemic, he came out and said he thinks the last 30 days are the highest spread of COVID-19 that we've seen since the pandemic started. And that's really because of the very high infectious nature of these viruses. So bottom line, we continue to stay together as a state. We continue to see an uptake of vaccines, although it is a bit slow. Remember, only about 31% of Americans have had 1 booster and about 5% have had 2 boosters. So we want to increase that in West Virginia, because we know staying up to date with vaccination is the best protection we can have. Thank you.
All right, thank you, sir. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. As Governor and Dr. Marsh pointed out, we continue to have slow but regular uptake of additional West Virginians getting vaccinated, getting their boosters. And I'd like to reinforce what the governor laid out is we owe a great debt of gratitude to our county health departments, our health providers, the National Guard, the pharmacies, and all the clinics across the state of West Virginia that have done such a great job of distributing those. Governor continues to press us to make sure that we continue to educate West Virginians both about getting a vaccine, but also about those additional shots that are needed. So our education campaigns continue on a daily basis, and we continue to press that. As pointed out, hospital numbers have increased somewhat. They are not increasing at a rapid rate, so we are doing well in that regard. 217, and remember, as we talked about last week, our metrics for what we need to watch are now much different than they were in the beginning. So 500 in the hospitals with our staffing challenges, with other challenges that come in summer months with influx of patients in other areas. 500 is really a challenging number for us in West Virginia. So we'll continue to monitor that. But again, Governor presses us to continue to keep up our education campaigns, our logistics that goes on behind the scenes. So when new vaccines come out, particularly for those under 5 years of age, a lot of work goes on by the team behind the scenes to make sure that providers, pharmacies, as well as in the central allocation, we get what we need to take care of our citizens. Very slow uptake in children, so we can continue to press to educate parents about the value of the vaccine. Thank you.
Thank you, sir. And finally, from Dr. Ayne Amjad, our State Health Officer.
Good morning. Tomorrow you'll see some updated numbers on our COVID dashboard with the variant cases. We continue to monitor and improve our data. These cases, the number of Delta cases for the variants are going to decrease by 634, Omicron by 364. These are still COVID cases, however, they're not associated with Delta and Omicron. When the algorithm for matching variant labs to cases was developed, we did not see a significant amount of reinfections among our population. So those numbers were matched with the older labs with the new cases. This has since been corrected, and we'll continue to monitor those numbers. Thank you.
Thank you, Doctor. Secretary Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from John Mark Shaver with WV News.
Good morning, everybody. My question is probably for either General Hoyer or Dr. Marsh. Early reports from the FDA are saying that they might be soon approving the vaccine for children under 5. When that time does come around, will the state be ready for it, and what will rollout look like? Thank you.
General, you do that one, please, sir.
Yes, sir, Governor. Yes, so as pointed out earlier, the work goes on with the interagency task force team, working with all the agencies at the state and federal level. So allocations are already being put in place for under 5 years old. Vaccines will go directly to pediatricians as well as pharmacies, and then a central allocation that will be managed by the interagency task force team. So I would say that we are already ready, and it is in progress of moving the logistics supply chain system to make sure that they are available to those young children when their parents make that decision. Thank you.
All right, thank you, John Mark. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. It's good to be back on the call with you guys. And Governor, I'm glad you've recovered from your Lyme disease. It's good to see you back as well. There is a framework agreement right now in Congress between a number of Republicans and Democrats on gun control. According to reports, that framework does not include a ban on any type of weapons, including AR-15s, expanded background checks, and also raising the age limit to purchase rifles. But what it does include that would affect the state probably the most is a new set of red flag laws with federal incentives for states to handle on their own. Governor, I'm just wondering what you think about the proposal as it stands right now. And with those federal incentives, do you think West Virginia not only would be able to handle enhanced red flag checking, but also has the desire to and would participate in that program to expand red flag testing? Thank you.
Kenny, and I'm doing anything but dodging this because I'm very familiar. I think it's good when any of our politicians in D.C. decide to work together and see if we can get across the finish line to where we can adopt some, federal law that works for all of us. From the standpoint of, red flag laws within West Virginia, I think the key to the whole thing with West Virginians is one thing, and that is, proper due process. I mean, we don't want invaded upon and everything if individuals don't have due process. So with all that, I think really what we've got to do is kind of wait just a little bit to see exactly if anything really does come down from Washington in regard to this and everything. But I'm just all I can say is I'm pleased that we're actually talking with one another instead of just throwing rocks back and forth on any issue. So let's just wait and see. But I think the bottom line to West Virginians is one thing, and that is not being invaded upon, and we have proper due process. So let's just wait and see beyond that. Thank you, Kenny, and thank you so much for your kind words. Appreciate you.
All right, thanks, Kenny. Next to Paul Mullen with WCBC. Having some issues connecting to Paul. How about Jess Mancini with Ogden Newspapers?
Hi, thank you very much for taking my question. I actually have a couple of questions. First, Governor, I don't know if you watched the hearings, the January 6th hearings last week, but if you did, was there any revelations that came out of there that maybe got your attention? And secondly, has there been any word from the federal government or the CDC on additional booster shots with the advent of these new variations of virus coming in? Or is a booster shot perhaps not enough for maybe another vaccine? I guess that would be for Dr. Marsh or Dr. Amjad. Thank you.
Well, let me take the front end, and Dr. Marsh, you take the back end and everything. But let me just say this. I saw enough of the ridiculous political theater in regard to January 6th. And you know, no matter what we do, there are a bunch of people out there that are just absolutely, no matter what Donald Trump did or Donald Trump said, no matter what it was, they absolutely just tried every way to twist it. The media in a lot of ways, a lot of absolute Democrat leadership and everything, to twist it and just make it into anything that it could possibly be, other than the simple fact, if we just stepped back and thought about it. So many things that our former president did were on point. And you know, in regard to January 6th, if we just listen to his words and we're fair. I mean, words like offering up the National Guard, words like, you know, absolutely, we want our voices to be heard, but only heard as true, respectful, honorable people without any level of violence in any way. You know, all this is the same old stuff that has driven this country into a mess, and that's all there is to it. Look at just what we're doing today in this country, and who in their right mind could absolutely condone or think what we're doing is the right stuff? You know, so to me, political theater, a waste of time, absolutely throwing rocks at a president that did a heck of a job, in my book. So Clay, take the other question, please.
Well, thank you, Governor, and thank you, Jess. So we know that the potency of the vaccines, particularly given the incredible high infectivity of these new variants from Omicron, the BA.2.12.1 variant and the BA.4 and 5 variants, are going to lose the vaccines will lose their potency relatively quickly, after over about 4 months or so. So we do anticipate that there will be a regular schedule that will come out over time that will help vaccinate appropriately people in the highest risk categories. In the United States, we've identified over 50 years old. Now, Moderna has come out with a more Omicron selective vaccine, and that seems like a good idea. The problem is that vaccine was initially designed against the BA.1 variant, the variant that caused all the problems over the winter. And we know that people that have recovered from the BA.1 variant don't have very much residual immunity toward these more current variants, the BA.2.12.1, the BA.4 and 5, and others. And so we do think that even though there may be some benefit for the BA.1 variant, some of these new vaccines may not really appreciably help us as much against some of the newer Omicron variants. Lastly, there are a lot of efforts going on to also think about a nasal vaccine, because this virus enters the nose, the mucosal membranes, and the kind of immunity for the mucosal membranes is a different kind of immunity than we get when we get a shot. So it's an IgA response versus, say, when we get a shot, an IgG response. So many people feel like by potentially having a nasal vaccine, we may also be able to make a bigger impact against the infectiousness of these viruses, because they enter our bodies through our mucosal membranes, through our nose and mouth and upper airway. So more to follow, but I think your question's correct. We will have a regular series of vaccines, and the key for people now is to please go to the vaccine calculator on Vaccinate.wv.gov or off the DHHR Coronavirus-19 website, and make sure that you stay current with your vaccinations. Very important right now. Thank you.
All right. Thank you, Jess. Governor, I'll turn it back to you.
Well, I don't have a whole lot, except it's a whole heck of a lot to go back and think about losing 7,001 West Virginians. Crossing a 7,000, the 7,000th threshold is, it's really tough. Tough for all of us, but especially tough for all those, the families and their loved ones and everything that have lost these great people. So, with that being said, we have only one choice, and that is to just keep moving and keep moving north and keep trying to do all we possibly can to stop one more person from us losing one more person. And we come constantly, we come with great honor, to try to tell you over and over and over about your booster shots or about getting vaccinated or doing anything and everything we can, as far as more and more testing. I said early on, and I go back and I think about, the early days and all the just incredible uncertainty and what we would have given for at that time a vaccine. And finally we got it. And the very people I just said a minute ago that are throwing rocks, continue to throw rocks at President Trump, just think how fast they moved with warp speed and everything in order to be able to get us that vaccine. But with all that being said, I guess what we do is we continue to live our lives, and I promote that in every way. We continue to respect everybody's, freedoms. I promote that in every way. And with all that, we continue to try to do everything we possibly can to make West Virginia better, have more and more opportunities to West Virginians. I said earlier about the great people from my office that have been in D.C., and they've been there working really, really hard, trying to find the right person to work this grant situation and get more dollars flowing into the state of West Virginia where we can create more and more goodness. That's what we need to do. That's how you mind the store the right way. The last time we had somebody in D.C. was under the Bob Wise administration, a long time ago. And I will promise you without any question, today, there are so many grant possibilities that are happening in D.C. In Bob Wise's administration, it would have been a drop in the ocean. But nevertheless, our people, I've instructed our people to not miss any possibility or any opportunity that we can absolutely bring to the state of West Virginia. And so from that standpoint, that's all the notes I made. I again ask you, please, at least pause just a second, and just think 7,001 people in West Virginia. It's been a tough go, but we're getting there, and we're just going to keep at it. So thank you so much. Get your booster shot, West Virginia. It's really important, really, really important. Thanks again.